Hi there.
Hi.
How are you?
Good, thank you. How are you?
I'm great. Thank you so much. My name is Dr. Matt. I'm going to do your full body examination today. Can you please verify your first and last name and your date of birth?
Then P-A-S-M-R and date of birth is September 21st, 68.
Okay, perfect. So you're here for your annual physical. When was your last annual?
Last year, September.
September. And were there any complications during that exam? Any abnormal findings?
Some hypertension.
Okay. Do you have any allergies, Dan?
I don't.
Perfect. Do you have any accidents, any work-related accidents?
No, I don't.
Okay. Are you taking any medications on a daily basis?
Yes, I do.
Okay, what kind of medication are you taking?
I'm taking statins for high cholesterol.
Okay. And do you remember how many milligrams of that are you taking?
5 milligrams a day.
Do you have any other medical problems besides hypertension and hyperlipidemia?
No, I don't.
Okay. Any sleeping problems? How's your sleep at night?
I sleep well.
Okay. How many hours per night do you usually sleep?
It depends. Sometimes 6, sometimes 7, 8.
Okay, so about 6 to 8 hours per night. And is that a good amount for you to feel rested in the morning?
Yes, it is.
Are you following a special diet? Vegetarian, vegan, or you eat everything?
I eat everything, but in low amount.
Okay. All right. So I believe I have everything I need. What I'm going to do today is a head-to-toe examination. I'm going to start with your head and finish up with your toes. Do you have any questions for me before we begin?
No, I don't.
Okay. Let's go ahead and begin. Are you experiencing any pain at the moment?
No, I don't.
Okay. Any tingling sensations in your arms, fingers, or your toes?
No.
Okay. Are you having any headaches
No.
that do not go away with medication?
No.
No. Perfect. Have you noticed anything swollen on your body? Anything concerning to you?
No.
Okay. So I'm going to go ahead and take your blood pressure. Is this arm okay?
Yes.
Do you mind holding this for me? Thank you. Okay, so both feet are flat on the ground. Okay, your blood pressure is a little bit elevated. It's 132/75. Any flu-like symptoms in the last 48 hours, Dan?
No.
Okay, I'm going to put this on your forehead. Go ahead and relax. Good, -6.3. And also let's go ahead and take your oxygenation. It's going to go on your index finger. Okay, relax. Oxygenation is 97th percentile on room air. Heart rate is 68, very relaxed. Is it okay if I put the stethoscope underneath your shirt? I'm going to listen to your heart. Okay, so just go ahead and breathe in normal. I'm gonna go ahead and move the stethoscope a little bit to the outside of your chest. Okay, very good. I was able to hear only S1 and S2, now S3, now S4. And I'm going to go ahead and try to see if I hear any murmurs, which would indicate a valve abnormality, and that would give me some indication if you have any symptoms of heart failure, but I'm sure that's not a fact, so let's go ahead and just make sure we don't hear any murmurs. Okay, there's one more point on the heart that we need to listen to. Good. Everything sounds very normal. I'm going to go ahead and listen to your lungs. Can you please take a deep breath in and breathe out? Good. Again. And exhale. Good. I'm going to listen to the sides. Is it okay if I lift your arm up? Perfect. Breathe out. Good. Relax. And on the other side. And breathe out. Okay. I'm gonna go ahead and palpate your head. Have you noticed any bumps or any lumps on your scalp lately?
No, I don't.
Okay. Okay. Head is symmetric. I'm not feeling any lumps. No tenderness. Okay. I'm going to test your neck strength. So what I'm going to do is I'll try to push your head that way, and I need you to resist that, okay? So what you will have to do is to turn your head the other way, so we counteract. Okay. Very good. Okay. And I'll do the same thing on the other side. So now I'll push that way and you push the other way. Okay, very good. And now I'm gonna need you to try to push down with your chin on your chest. Good. And one more time. Push down. Good. Okay. Now I'm gonna need you to shrug your shoulders, okay? I'm gonna try to push down. Go ahead and relax. And now do it. Shrug your shoulders. Okay, perfect. All right. Is it okay if I do a scalp check? I'm going to make sure that there are no parasites or that your hair follicle looks very healthy. Go ahead and open your eyes. Everything looks very good. I could not find any abnormalities with the scalp. And what I'm gonna do now is I'll check your facial sensation and to make sure that there's no tenderness on your face. Is it okay if I palpate your face?
Sure.
Okay. Good. Okay, so I'm palpating the masseter muscle and the TMJ. Can you please clench your jaw? Good. Relax. Clench again. Very good. So that was very symmetric. That's good. Okay. Good reflexes. I'm going to check your sinuses. So what I'm going to do is I'll press gently right here underneath your eyes. I don't feel anything swollen. No pain. And right here above your eyebrows. Good. Okay. Okay, go ahead and keep your eyes closed and tell me if you feel this on your face. Did you feel that? Yes or no?
Yes.
Okay. Did you feel that equally on both sides? Yes or no?
Yes.
Did you feel that on your face?
Yes.
And did you feel that equally on both sides? Yes or no?
Yes.
And what about that? Did you feel that equally on both sides?
Yes.
Okay. Wonderful. So what I'm going to do now is called sharp or dull test. I will be touching you with two different textures on your face and perhaps on your neck, depending on your answers. What I'm going to need you to do is to tell me if you feel sharp or dull sensations. I'm going to go ahead and show you what sharp will feel like right here on your chest. So that's what sharp will feel like. And this is what dull will feel like.
Okay.
All right, go ahead and keep your eyes closed and tell me if you feel sharp or dull.
Okay. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. 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 Dull. Dull. Sharp. Dull and sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp.
Okay. Okay, then, very good. So what I'm gonna do now is I will check how your body perceives vibrations. I will be creating some vibrations and touching you on your face and on your neck with it. I'm gonna need you to tell me when you feel it, okay? So all you have to do is just say yes or I feel it. Okay, keep your eyes closed.
I feel it. I feel it. I feel it. I feel it. Yes. Yes. I feel it.
Okay, Dan, so what I'm going to do now is I will check your eyes. Do you wear any contacts?
No, I don't.
Okay. Have you noticed any abnormal discharge, any redness, or any pain?
No.
Okay. So what I'm going to do is I'll gently palpate you around the eyes. Tell me if you feel any kind of pain.
All right.
Good. Okay, go ahead and open your eyes. I'm going to have you look straight at my nose. Good. Keep on looking straight at my nose. Okay, very good. Pupils are round and reactive to light and accommodating. That's perfect. I'm going to have you follow my finger with your eyes only. Don't move your head, okay? Follow my finger with your eyes only. Don't move your head. Okay, so your eyes are moving a little bit faster than my finger. What I'm going to do now is I will bring the pen light very close to your nose, and I need you to look at the nose at the pen light as I'm doing that. Okay, so go ahead and try to focus on the pen light. Okay, good. Let's go ahead and do that one more time. Keep on looking at the pen light. Okay, perfect. Alright, so what I'm going to have you do now is I'll have you hold the Snellen chart with the right hand. Go ahead and extend your arm all the way. Perfect. And can you please cover your left eye with your left hand? Do you see all the rows?
Yes, I do.
Okay. Can you please tell me what letter this is?
L.
What about this one?
P.
What about that one?
P. H.
Great. Can you please tell me what color this is?
It's red.
And what color is this?
Green.
Okay. Okay, let's go ahead and switch eyes. Okay, no cheating. Very good. Can you please read the last row starting with the letter H?
H. P. F. T. L.
Perfect. What color do you see right here?
Green.
And what color do you see here?
Red.
Is this the same amount of red that you saw with your right eye?
Yes.
Okay. Very good. Alright, so what I'm going to have you do now is I'll have you tell me which fingers are moving, my right or my left, okay?
Right.
Okay. Try to keep your vision straight. Do not look at the fingers. So make sure that you see the fingers even without turning your eyes. So try to keep focusing on my face.
Left.
Good.
Right.
Good.
Left.
Good.
Both. Right.
Good.
Left. Right.
Wonderful. All right, so now I'm gonna have you tell me when you don't see my fingers in your field of vision. So for that, we're both gonna go ahead and cover one eye. So go ahead and cover your right eye, and I'm going to come a little bit closer to you. So please tell me when you see my fingers in your field of vision.
No.
Okay, good.
No.
Good.
No.
Good. Okay, let's go ahead and switch eyes.
No.
Good.
No.
Good.
No.
Okay, perfect. All right. I'm going to check you for color deficiency. Can you please tell me what number you see here?
12.
Okay. Can you please trace this number for me and tell me what number you see?
57.
Good. Again here.
74.
Good. And here.
5.
What number do you see here?
I don't see a number.
Okay. Can you please trace this line from this X to this X? Okay. Same thing here, but trace the color pink, not red. Okay. Very good. Now I'm going to check your ocular nerve. For this, I'm going to have you look behind me straight at the wall. Try to keep your eyes open all the times. Okay. Ocular nerve is intact. The left side, I'm not seeing any scratches. Okay. Go ahead and look behind me straight at the wall. Okay, very good. I'm not seeing any scratches behind the retina. Keep on looking straight and keep your eye open for me, please. Good. Great. Okay, Dan, I'm gonna go ahead and check your mouth and your throat. Any signs or symptoms of a sore throat?
No.
Okay, go ahead and open your mouth wide and tongue out, please. Good. Say ah. Okay, very good. Everything looks very healthy. Okay, let's go ahead and check your sense of taste. What I'm gonna do is I'll put one drop on your tongue. Can you please identify this taste for me?
Coffee.
Okay, very good. And what I'm gonna do is I'll take a swab of inside of your cheeks and I'm gonna send it to the lab. We're gonna test it for any DNA abnormalities. Is that okay?
Sure.
Alright, so go ahead and open your mouth. Okay, that's one. We have to take 2 samples. And that's 2. Alright, we'll have the results back in about 2 weeks. Okay. Have you noticed any discharge from your nose?
No.
Okay. Go ahead and look up for me, please. Okay, nasal mucosa is pink and moist. No swelling. I'm not seeing any polyps. Good. I'm gonna go ahead and palpate your nose. Let me know if you feel any kind of pain. Any pain there?
No.
Okay. Keep your eyes closed for me, please. And I'm going to go ahead and cover one ear. Can you please smell this and identify the smell?
Mint.
Good. Okay, I'll do the same thing, but with your other ear now.
Cinnamon.
Okay, good. And now I'm going to ask you to keep both ears open, patent, and tell me what this smells like.
Cinnamon.
Okay, very good. Excellent. Okay, keep your eyes closed, and I'm going to go ahead and check your hearing. What I'm going to do is I'll whisper some words in your ears. I'm going to need you to repeat them back to me, okay? Dan P ASMR.
Then PASMR.
Good. Trust me, I'm a doctor.
Trust me, I'm a doctor.
Okay. Good. Go ahead and tell me with which ears you hear the sound.
Left. Right. Both.
Okay. Do you hear this sound?
Yes.
All right. Can you please tell me when you don't hear it anymore?
No.
Okay. Do you hear this sound?
Yes.
Tell me when you don't hear it anymore.
No.
Good. Okay, tell me which position here is louder. This position, position number 1, or position number 2? Which one here is louder? Position number 1 or position number 2?
Not sure. Number 1. Not sure.
Okay, let's go ahead and try that one more time. So this is position number 1, and this is position number 2.
Number 1.
Okay. So this is position number 1, and this is position number 2. Which one here is louder?
Number 1.
So what I'm going to do is I'll take a look inside your ear canal. Tympanic membrane is pearl gray, but I did notice a lot of fluid buildup in the back of the membrane. So let's go ahead and see how your other ear looks. Okay. Both ears have a lot of fluid buildup, which really could indicate an ear infection, and that could result into you hearing differently. And usually what a normal ear would hear is position number 2 is the loudest, but for you it was opposite. So that really tells me that you have a lot of fluid buildup, either right here in front of the ear or in the back on the mastoid, right next to the mastoid bone. So what I'm going to do is I'll send you for a CT just to make sure that there is no deeper infection. Okay?
Okay.
Okay, Dan, are you comfortable?
Yes.
Perfect. So what I'm going to do first is I will listen to your abdomen, make sure that all the sounds are within normal limits. Is it okay if I lift up the shirt a little bit?
Yes.
Okay, so I'm gonna have you breathe normally. You don't have to take a deep breath in. Okay, I'm also gonna go ahead and listen to your neck while we're here. And I'm gonna need you to take a deep breath in and hold it, okay? Hold it for 1, 2, and 3, and breathe out. Very good. So I could not hear any brewy or swishing sounds. Go ahead and again take a deep breath in and hold it for 1, 2, 3. Breathe out. Okay. Let me know if you feel any kind of pain. Good. Good. Okay, and now I'm gonna go ahead and palpate your abdomen. Let me know if you feel any kind of pain. I'm trying to see if you have any enlarged organs or if I'm feeling any signs of masses. It's very good. So no pain, no tenderness. I could not feel anything. Okay, I'm gonna go ahead and press down where your ovaries are. Let me know if you feel any kind of pain. Any pain here?
No.
Okay. Good. All right, I'm gonna have you turn on your belly now and I will examine your back, okay?
Okay.
Okay, so I'm gonna start by examining your cervical spine. Just gonna go ahead and gently palpate. I'm noticing a slight enlargement of the cervical and thoracic region, just of the curvature, but nothing too worrying. Okay, so no signs of scoliosis really, and pretty normal curvatures of the spine. Good. So no indication of any fluid buildup. Go ahead and say 99 for me, please.
99.
Again.
99.
Again.
99.
Good. Take a deep breath in and breathe out. Good. Again, take a deep breath in and exhale. One more time. Again. Okay. So I could not hear any wheezing, no crackles, no sign of any pulmonary infiltrates. Okay, good. All right, let's go ahead and examine your feet now. So first I'm going to go ahead and do a visual examination. I'm noticing that you do have a few moles, but they look good. No signs of any abnormality there. They look normal shape. Color is light brown, no discoloration. I'm gonna go ahead and take a look in between your toes. I'm looking for any fungi infections, any eczema. That's good. Good. Very normal color. And no signs of any fungi infections. Okay. I'm gonna go ahead and check your Babinski reflex. So go ahead and relax your foot. Relax. Good. Perfect. Okay, and on to the same thing on this side. Relax. Good. I'm gonna go ahead and take some measurements of your face. Make sure that everything is symmetric. I'm looking mostly at the extremities, so I want to make sure that your ears are symmetric with your face, also your nose. I'm going to measure your hands and your feet. Okay. Okay, so we're looking at the right ear, 2.7. Okay, 2.7 as well. Nose, that would be about 1.8. Okay, so I'm going to go ahead and examine your lips. That is 2.3. Okay, and go ahead and just sit down. Eight. Eight and a half. Okay, perfect. 8.5 as well. Alright, so I'm gonna go ahead and put this in my chart. Okay, go ahead and relax your jaw for me. Relax. Okay, very good. Okay. Good. Okay, and relax your feet as well. Good. Okay, excellent. Okay, perfect. Okay, all reflexes within normal limits. I'm going to go ahead and write the prescription for the CT scan. It's It's going to take about 20 minutes for that. It's not going to take a very long time, and it's definitely painless. So we're just going to have to rule out any infections, okay?
Okay.
All right. Thank you so much for allowing me to do this exam on you. Do you have any questions?
No, I don't. Thank you so much.
You're welcome. All right, so I'll see you back soon. Take care now.
Thank you.